Hi everyone. Thank you very much for coming and allowing me to have some of your time to talk to you about an issue that is very important to me. There is something that quarterback David Garrett, Miss America 1959, Ann Mobley, and 90210 actress Shannon Doherty all have in common. But I'd almost be willing to bet that none of you can ever guess what that is. These four people, who seem to not have a common factor amongst them, all suffer from a disease called Crohn's. My niece, Mackenzie, is a 15-year-old high school sophomore from a very small town in Kentucky. Yet, she can also join this list of unseemingly connected people along with 700,000 people in the United States. Many people don't know the symptoms to look for in having Crohn's, so I'm here to tell you all about it, what to look for, and how to get treatment for this horrible disease. Crohn's is an incurable disease that can be debilitating if not treated correctly. This disease is a chronic inflammatory bowel disease. It's characterized by the inflammation of the digestive or gastrointestinal tract from the mouth to the anus, but is more commonly found at the end of the small intestine where it joins the beginning of the large intestine. It's very important to not confuse an inflammatory bowel disease like Crohn's for IBS. Irritable bowel syndrome. Irritable bowel syndrome is not characterized by intestinal inflammation and is not a chronic disease. Crohn's doesn't discriminate against who it can and will affect. However, when looking at the statistical standpoint on Crohn's, only 1 in 2 patients are under the age of 18 at the time of diagnosis. Mackenzie was just 8 years old when she was diagnosed. This disease can occur at any age, but on average, people are more frequently diagnosed with Crohn's disease between the ages of 15 and 35. It also has some biological factors to consider, like people of a Jewish heritage having a greater chance, while African Americans are less likely to contract this disease. Studies also prove that it does not affect men or women more, but both equally. It also appears to be more common in developed countries. Now, you may be wondering what exactly can cause you to have Crohn's, and there are a couple different factors that can contribute to this. Factors like heredity, the immune system, and environmental factors. You can inherit some genes that make you more susceptible to developing Crohn's, or bacteria, virus, or other environmental factors may contribute as well. Now, I've told you what Crohn's is and who it can affect. Please allow me to tell you about some of the symptoms that can occur and the most common treatments available. Symptoms may include abdominal pain, diarrhea, reduced appetite, unexplained weight loss, rectal bleeding, possible fever, fatigue, and even anemia. When seeking treatment, according to BIDMC, Harrod Teaching Hospital, there are a few different ways to manage this disease and the symptoms that come along with it. These include antibiotics, steroids such as prednisone, and surgery. If you identify with some of these symptoms, then you would likely undergo a few tests and procedures at your doctor's office to get a diagnosis. This is because there is no one test or assessment that can solely diagnose you with Crohn's disease. Even though there are medical treatments that help manage this disease, they can't be solely relied on to relieve all of your symptoms. You also need a great support system, a good diet, exercise, and effective ways of dealing with common, everyday situations. While trying to figure out a good diet for you, it may be hard to pinpoint certain foods that cause you to have the flare-ups. Please remember that foods do not cause symptoms, inflammation does. Crohn's disease is unpredictable. Over time, your symptoms may change severity, and you can go through periods of remission where you have little to no symptoms. Your symptoms can also come suddenly without warning. Crohn's is an unfortunate disease and one that most commonly goes the longest without being recognized because of its symptoms. Today, we've talked about who it can affect, how to recognize the symptoms, and common treatments. The treatments that we have discussed can make the disease a manageable one. If you or someone you know recognizes these symptoms that we've talked about today, please don't hesitate to see a doctor. The sooner that it's treated, the sooner you can put it into remission and cannot handicap you while you're trying to live your life. Thank you.